However, assuming that we do want to keep doctors in the PAS equation, as Oregon's law does, we should probably try to better understand the actual reasoning that underlies this second argument made by the opponent. So why exactly does the opponent claim that it's intrinsically wrong for a physician to participate in PAS? Michael Gill imagines that the reasoning is something like this. Physicians and doctors are only supposed to make medical decisions, and physicians and doctors are only supposed to, or are primarily supposed to, such as Daniel Callahan argues, promote life and health of their patients. So to ask a physician to participate in the suicide, the death of one of their patients, is to ask them to do something that is outside of their area of expertise, right? To ask a physician to engage in PAS is to ask them to make an evaluative judgment about the worth of their patient's life. And perhaps doctors should not be making those kinds of decisions. Doctors have great medical knowledge, but do they have the knowledge and expertise regarding when a life is worth living, or when one's death would be better than living the rest of their life? The opponent is arguing that doctors do not have the abilities or the expertise to make those kinds of decisions. That's not within their role. And so therefore, it's intrinsically wrong to ask the doctor to participate in suicide or the death of their patient. In response, Michael Gill essentially claims that this is just plainly false. The Oregon PAS law does not, according to Gill, require doctors to make any kind of evaluative or spiritual decisions for their patients. According to Gill, the PAS law in Oregon requires doctors to make two decisions. Number one, is the patient terminal? Will their illness kill them within 6 months? And two, is the patient competent? Is the patient mentally able to make the autonomous choice for themselves of when and how to die? According to Gill, those are both medical decisions based on medical facts. It's not based on an evaluative or spiritual judgment that the doctor makes for the patient. In fact, the evaluative judgment about the worth of the patient's life, according to Oregon PAS law, is made by the patient themselves. That's the whole reasoning behind the competency requirement of the law. That's why doctors must require their patients to be competent so that they can make the choice for themselves. The doctors are not supposed to be making these decisions, evaluative and spiritual decisions, for the patient. Therefore, this opponent's argument and their reasoning is just plain false, according to Michael Gill.